I felt ICU and ER was my life. I loved the whole family dynamic and being part of the whole portion of nursing care. I've been with St. Luke's 23 years, and one day I had the local paramedics come in, they took a patient from me and they asked me if I would be interested in applying for Air St. Luke's. And it's like, I've never really thought about that, but I did. Thankfully, by a few prayers and the wings of whatever, I was able to become a flight nurse with Air St. Luke's. I started with them in 2007 when we opened the base in Twin Falls. And since then, I couldn't imagine not doing it. I can't imagine not being part of, this program, the family atmosphere, the group. Brandy Bartholemew, Manager of Quality Patient Care and Safety and Flight Nurse based in Twin Falls. I am responsible for all of our quality matrix, which also includes making sure we are in compliance with all of our regulatory and governing bodies. It's amazing. Every day, yes, there's stress. Yes, go through a lot of, ups and downs and seeing the patients and what, their families go through, but I wouldn't change anything. I think really the difference between ER and ICU in compared to flight nursing and being in the aircraft is the autonomy, for one. And then the other thing too is, you know that when you come on duty and whatever comes within your path, you are there with that person at probably one of the worst times of their life, and you know that you are making a difference for them and for their family, whether, moms, dads, their children. Based in Twin Falls, we have a lot of long legs, and so we're able to go out, land on scene with a patient. Depending on their severity, we can go directly to a level 2 or even a level 1 trauma center in another state with their performance in our range. We can be flat ground, farm ground, landing to pick up someone who has had an ag injury, to the next flight can be up in the sawtooths, high altitude, weather, speed. It all just kind of comes together as far as being just an amazing aircraft and being able to meet all of our needs. Being able to load and unload from the side, it's great because it's such a wide opening for us to be able to get the patients in. Being able to do all the interventions that, we are trained to do, so intubating, surgical cryogs, chest tubes, vibration is very minimal. It's great. The other thing that is very beneficial is the room in the back. We're able to have that patient where they are nice and secure, and we're able in our configuration to be able to do everything that we need for them, whether it's stabilize their airway, put in chest tubes, start drips out of bags, whatever it might be. That configuration is we can get to our equipment and everything that we need easily. One of the key things I really respect with this airframe is the fact that we can take family members. And that is so hard, especially when you've got that 3-year-old trauma, that little PICU, NICU babe in the back, and mom and dad are able to go with you versus having to drive the hours to get to where they are. So that's the other thing that is great about this aircraft as well. I'm very fortunate. As I travel around the United States and teach trauma, we always talk about what our platforms are, what we fly in, what our experiences are, and I'm able to say that with Idaho Helicopters and our hospital-based program, safety comes first. And they are, all on board, and we're fortunate to say that our primary aircrafts are 429s and our backup is a 429. So yeah, maybe a little helicopter snobby. But it's because it's a great platform. It's great. It serves our communities and our patient needs tremendously. It's great. You just can't say enough about the support from both Idaho Helicopters and St. Luke's Health System, with them wanting to ensure that we are in amazing aircraft, that we are safe, be able to give back to our communities, not leaving people behind. We have a lot of outdoor recreation all around us, and we're able to get there and take care of those patients to the best of our ability. St. Luke's Health System, they really support us in our program because they know the care that we provide in the aircraft that we have, and we're giving back to the communities. Thank you to St. Luke's Health System and, again, Idaho Helicopters for allowing us to do what we love, and our crews are amazing.